Is intermittent fasting safe or not? Or should you try the 98th or the 99th diet that your fitness app is now recommending? If you're confused about this, you are not alone. With the sheer number of diets out there, from keto to Atkins to South Beach, Weight Watchers, Noom, etc., it's hard to know which one would really work. But the truth is, these umbrella diets do not work. They are not individualized to your body constitution type, and they may not work for your particular situation. Hello and namaskaram all. This is Dr. Neha Garg here, a nephrologist and an aspiring yogi. I would like to begin today by sharing a very fun anecdote. There was this medical student, let's call him Rama, who was exemplary at everything. Excellent GPA, healthy eating habits, healthy weight, and a long distance running regimen. But despite all of this, he developed severe lower back pain issues. After a plethora of X-rays, CAT scans, MRIs, no cause was found. Rama tried physical therapy, acupuncture, many chiropractors, but the nuisance back pain would just not go away. Everyone felt he was too young to undergo a back surgery, and that too without a guarantee of complete success. So out of options, he went to an Ayurvedic practitioner and was given this advice to eat only pineapples for the next 2 weeks. This advice seemed quite insane at that time, but this was an Ayurvedic practitioner of much repute, and poor Rama was out of options and grasping at straws. So he kept his logical mind aside and ate only pineapples for the next 2 weeks. Guess what? The backache went away. Now, all of us thought that this was just a fluke. But when we look at the Ayurvedic diet text in more details, we find that this is not. Rama had developed an imbalance in his Vata, or the Airy bioenergy, which triggers lower back pains. It can be fixed with more citrus intake, which is exactly what he was prescribed. Pineapples only for 2 weeks. So in today's video, we will discuss why one-size-fits-all approaches do not work. We will also look at the body constitution types as defined by Ayurveda and how certain foods can work better for a particular constitution type. We would all agree that the body of a 100-pound person is not the same as that of a 150-pound person, is not the same as that of a 200-pound person. Similarly, the body of a growing child is not the same as that of a grown adult, is not the same as that of an aging older adult. These differences in the body structure and framework, they are not only external, but they also apply to our daily caloric needs and our intrinsic stores of calories and fats in the liver and in the fatty tissues. Growing children who are still developing their bones and muscle mass, they obviously need more nutrition in the form of more calcium, more calorie and fat-rich foods, but this does not apply to adults. However, we forget to keep this in mind, and we keep having the same foods as what we were eating when we were in our youth. All of this amounts to intake of more meals than what is needed, the worst of which is our breakfast, which often consists of waffles, bagels, sandwiches, omelets, and an excess of dairy in the form of cheese, yogurts, ice creams, all of which only leads to a fat belly and a fatty liver. We would not refuel a car tank which is already full. Similarly, in a steady, balanced state, adults do not need more than 2 meals in a day. Let me share 2 quick pointers to determine if you already have adequate total stores of calories or not. One is your waist circumference. Waist circumference is a very important predictor of your metabolic and cardiac disease risk, and this is independent of your age, gender, or BMI. So just your waist circumference alone is enough to predict your future risk of a fatty liver, diabetes, heart disease, and death. For Caucasian or European population and those with a constitutionally larger body frame, the waist circumference should be less than 35 inches for women and less than 40 inches for men. For those of Asian, Chinese ethnicity, the targets are lower because of their smaller bodies frames. For women, it should be less than 31 inches, and for men, it should be less than 34 inches. Now, if your waist circumference is more than these targets, then a diet plan is likely to not work for you because you already have an excess of total body caloric stores. You will actually have to begin with an intensive caloric restriction or intermittent fasting first to empty the storehouse. And this intermittent fasting, it essentially means maintaining a gap of 12 to 14 hours between your evening supper and between your morning brunch. And during this time, you should not be having any late night snacks, any other snacks, fruits, or any drinks except for water. The second hint about your caloric stores can be obtained from your lipid profile. So 2 items on your fasting cholesterol or lipid profile are reflective of your metabolic state and your body's insulin production. These are the triglycerides and the HDL. So we look at the ratio of triglycerides to HDL, which ideally should be around 2. Now, if this ratio is higher than 3, then that means you have insulin resistance, which means your pancreas is already working overtime to produce more insulin so as to process all the junk carbs and fats that are being put into the body. Now, if this ratio is higher than 4, then you may already have a fatty liver, and it's very likely you may also be developing some cholesterol plaques in your coronaries. So now this all brings us to what kind of diet and how to eat. So this has been addressed in extreme details in Ayurveda, where a mind and body composition analysis is done first, which is called a Prakruti, and then the diet plan comes next. So once the Prakruti or the metabolic type is established into the 3 main categories, all of your diet, your exercise plan is tailored accordingly. We will discuss more details about these 3 metabolic types next. The Vata metabolic type, they have an airy and dry quality with a light, slim build. They tend to walk fast, talk fast. They have an active and imaginative thinking, and they tend to be creators and thinkers. They do not tolerate cold or dry environments very well, and they are prone to disorders like anxiety, insomnia, high blood pressure, osteoarthritis, bloating, gassiness, lower back pains. Vatas have an irregular digestion, and they are prone to colicky abdominal pains and bloating. So they should avoid eating too much of cold, frozen, dry foods, and too much of raw foods like raw salads, cruciferous vegetables, stimulants like tea or coffee. Their body does well with more butters, oils, warm foods like stir fries, dairies, potatoes, yams, cooked rice, and citrus fruits. Small, more frequent meals tend to work better with their irregular digestion. Next is the Pitta metabolic type, who have a fiery quality with a moderate to athletic build. They have sharp intellect with quick decision-making capabilities, and they tend to be natural leaders. They have intolerance to heat. They tend to have a very strong digestion, and they're prone to heartburn, skin inflammation like acne, joint inflammation, body and breath odor. Pittas being prone to heartburn, diarrhea, and stomach inflammation, they should prefer light cooling foods like cucumbers, squashes, melons, and sweet fruits like peaches, pears, plums, honeydew melons, raw salads, and some dairy. Excessive intake of sour fermented food items and very salty or spicy foods will aggravate their heartburn symptoms. We will discuss more on that in our next lecture. They have a strong digestion and they need a large lunch. Herbs like ginger, coriander, fennel, mint, and black pepper, they help with their inflammation symptoms when they are flaring up. Kapha metabolic types, they have an earthy quality with moderate to large bills. They tend to have high endurance. They are calm, loving, well-organized, and patient by their personalities, and they tend to be teachers and therapists. They are intolerant of cold and humid weather conditions, and they have a slow, delayed digestion. They are prone to allergies, excessive mucus in the sinuses, in the chest congestions, weight gain issues, thyroid disorders. Excessive caloric intake can turn the body's metabolic pendulum into an imbalanced Kapha type, with slow, delayed digestion, heaviness, and weight gain. Kapha should avoid very calorie-rich, greasy, heavy foods. They should avoid meats, eggs, too much of dairy, sugars, desserts, and high-calorie nuts. What works best for them is low-calorie food items like leafy greens, watery vegetables like zucchini, green beans, squashes, bell peppers, sprouts, lentils, and other watery foods. Due to easy weight gain, they should avoid large quantities of food, and they do well with just 1 or 2 meals in a day. Lastly, to sum up, there are 2 main takeaway points for everybody and for all body types. 60% of our body is water, so 50 to 60% of what we eat should also be water. Prefer bowls over plates. Soups, porridges, khichdi, congee, risotto, ramen bowl, pho bowls, they are much better than dry sandwiches, pizzas, paranthas, and burritos. Prefer diets that require forks over knives with more of raw foods like salads, fruits, seeds, instead of meats, eggs, heavy dairy, and dry casseroles. Just doing this alone will help you keep your caloric intake under check and will have your body feeling light and active. I hope this video helped clarify why not all diets are created equal and how you can choose the right approach for you. We will delve deeper into the details of Ayurvedic metabolic types in our incoming videos. If you found this helpful, don't forget to give it a thumbs up and subscribe to the channel for more health tips. Please let me know in the comments if you have found a diet that truly works for you. Thank you for watching, and I will see you in the next video. Namaskaram.